When someone experiences a severe drug overdose in a rural community, the geographic distance to the nearest hospital can turn a life or death crisis into an uphill battle. But according to a major funding announcement highlighted by Watauga Online, the state of North Carolina is radically rethinking rural emergency care. By dedicating $10 million in new state funding to the North Carolina Rural Health Transformation Program, officials are transforming first responders from an emergency transport service into a direct mobile frontline for long-term addiction recovery. The initiative, managed by the NCDHHS Office of Emergency Medical Services, is being distributed among 39 local agencies across the state, including 6 vital high country agencies: Watauga, Avery, Alleghany, Mitchell, Wilkes, and Yancey counties. The money is specifically earmarked to build up mobile integrated health programs. Instead of simply stabilizing a patient after a 911 call and dropping them off at an emergency room, paramedics are being given the specialized tools, training, and medications needed to initiate treatment right on the spot. This includes providing immediate medication for opioid use disorder and executing rapid, systematic follow-up care in the critical days immediately following an overdose event. For the recovered life community, this funding directly addresses an agonizing geographic inequity. State health data shows that rural North Carolinians experience significantly higher rates of fatal drug overdoses and overdose-related emergency room visits than individuals living in urban centers. In rural areas, a lack of local clinics and long travel times often mean that people who survive an overdose are left with zero immediate connection to local treatment networks, trapping them in a revolving door of crisis. By meeting individuals precisely where they are, in the very moments after they survive a life-threatening event, this program bridges the gap between emergency crisis management and sustainable long-term rehab. Paramedics serve as a trusted, immediate link to regional peer support, counseling, and medical stabilization. True recovery relies on proactive, locally driven infrastructure that recognizes human worth regardless of a person's zip code. By empowering our frontline EMS workforce to act as compassionate navigators of healthcare, this investment ensures that those wrestling with dependency in our rural communities are never left stranded in the dark. This regional health milestone was originally reported by Watauga Online, and you can review the complete list of grant recipients through the link in our show notes.